Good afternoon. Come in, come in. You must be my last appointment for the day, which is fabulous. It means I get to spend a little more time on you. Yeah. I'm very excited. Just have a seat there, please. And so what brought you in today? You're having a little bit of eye... Okay, some eye issues. That's totally fine. I had a few questions that I wanted to ask you, if you don't mind. Yeah, thank you so much. Okay, so when did these... It was blurriness, right? Okay, when did the blurriness start? Okay, about a month ago. Alright, and do you get any headaches with that? Anything at all? Some tension headaches. That makes sense, no? Any nausea or dizziness? Sure. Okay, yeah, I know it doesn't feel good. So that's why we're here today, so I can help you hopefully diagnose the cause of this. And do you get any other muscle pain, anything else like that? No, okay, well that's good. That's good. Alright, that's fabulous, thank you so much. So, I have a few tests I'd like to perform with you. One or two of my instruments is new, so I'll just need a little bit of your patience, please. And we're just going to start off with something basic, and that's going to be the light. Okay, fabulous. So I want you to, you see this light over here? I want you to follow it with your eyes. Okay. Awesome. That's fantastic. Okay. And just follow it across. Amazing. And up and down. You're doing so great. Yeah, thank you. And just let me know if you need to take a break at all. Okay, and I'm going to bring this in. Alright. And on the other side. There we go. Okay. Fabulous. I just need to write down some of these results too. Great. Alright, so the next one is I have a pretty standard eye test. As you can see, it's brand new. I just need to get it out. Alright, so as you can see, it is one of those standard tests, and it has all of the letters on it. I would like for you to please read the top 3 lines. Okay. Yeah. Fabulous. Okay. Great. That's fantastic. No, that's perfect. Right. No, that's good. Don't worry. That's perfect. Alright, okay. And we're gonna do that again, but I need you to please take this, and I need you to cover first your left eye. Okay. That's perfect. And then I need you to read now, going down to the 4th row. Can you read the 4th row for me, please? Okay. Oh, I'm sorry, there's some glitter. Alright, okay. Okay, so you can do the 4th row, that's perfect. Sorry, it's a bit blurry, there we go. Okay. Fabulous. Alright, that's great. And now the fold forward but backwards, please. Okay. That's perfect. That's great. No, that's absolutely great. Okay. And I just want to check that again. Sorry. Awesome. That's fabulous. Oh, you're doing super well. You're doing so great. Okay. Next, I have this kind of peculiar little thing, and I'm going to need you to look through the hole and then tell me what you see once I drop this little part. Alright, okay. Yeah. And I'm going to lift it. Do you see my face? Fabulous. Okay, I'm going to close it again. Okay. Great stuff. Awesome. No, that's perfect. And we're going to do it on the other eye. Okay. Yeah. Do you see me? That's great. That's great. Thank you so much. Thank you. Yep. That one is a little different. No, that's great. Okay. I just want to have a look in your eye now so that I can see what your pupils and your irises are doing. So I'm just going to magnify that. Yep. And if you'll just look at my nose, please. Awesome. Okay. Amazing. And okay, so we're gonna do the same thing, but I just need you to look up and down. Okay, thank you, thank you. Okay, so we're gonna go up. Alright, and the other side. Awesome, and perfect. No, you're doing amazing, thank you. And down, just looking down. Yeah, fantastic. That's great. Alright, so I know the light is a little bright, but it really is. I'm getting a lot of information from this. It's really helpful, and I'm hoping that we'll be able to sort out any issues that you're having. So now, it's a little bright, I know. I'm going to hold this up, and I need you to please follow my finger. You see my finger? Yeah. And up. Okay, that's perfect. Alright, and this one. Yeah, just keep following my finger. That's perfect. Alright. And up. Okay, fantastic. I need to do that similar test. But now I'm going to need you to cover each eye for me, please. Yeah, I know it's a little repetitive, but I really am. I'm getting the information that I need. It's super, super helpful. Thank you for your patience. Thank you. Okay, so I need you to cover your left eye, please. Okay. And I'm going to need you to follow the light now. As much as you can without turning your head. Perfect. Okay, and now I need you to please look at my nose. Yeah, if you just take a look at my nose. That's perfect. Fabulous. Okay, yeah, no, that's great, thank you. Alright, and we need to do the same thing, but on the other eye. Thank you so much. Okay, alright, so just hold that up to that eye. And okay, so this time I need you to follow the light first, please. That's great. And up and down. Yeah, try not to move your head, please. Just follow it with your eyes. Okay, and I'm going to do it again, but this time have a look at my nose, please. Okay, keep following. Yeah, sorry, look at my nose again. Alright, that's great. I need to look inside your eye one more time. This lens shows me the depth, your depth perception. Okay, so I'm just going to come in a little close. Is that okay? Alright, thank you. Okay. Alright. Thank you. No, that's perfect. That's great. Alright, and now I'm going to do that again, but I need you to look up and then down and left and right when I tell you, please. Okay. Thank you. Thank you so much. I really appreciate how great you've been. Alright. So look up. And down. Yeah, that's perfect. And left. And right. Okay. And now I need you to look through the lens at the spot over my shoulder, and I'm gonna shine the light in again. Okay? Okay. So look over here, and it's gonna be a little bright. Okay. Alright. Perfect. Amazing. So that's your left eye. And you need to repeat on the right eye, please. Yeah. If you need a little bit of a break, that's totally fine. Just let me know. I can get you some water. We can take a little break to rest your eyes, whatever you need. Like I said, I have plenty of time to spend on you, and I really want to get to the bottom of these issues that you've been having. I want to make sure that you live a life that is pain-free, headache-free, not blurry, crisp and clear. Yeah, okay, so I'm going to look in the other eye, and we're going to use the light again. So, first I need you to look up and down, please. Okay. Yeah. Up and down. Okay, and up again. Okay, and right. Great, and left. Fantastic, alright. And I need you to look over my shoulder again. I'm going to do the light again. I apologize, it is pretty bright. Okay. That's great. Alright, I think you can take a little bit of a break. I just want to look at some numbers here. Yeah, so I think I can start to see what is causing the issue in terms of the depth and being nearsighted and farsighted. Yeah, absolutely, that's great. No, okay, I'm going to go back to the standard eye test. If you So this one is going to get a little more difficult. There's no wrong answers. I just need to see what you see. I need to know what you're seeing. So we're going to go to the 1, 2, 3, 4, 5th, the 6th line over there. Okay, so if you could please read that out for me using both your eyes. Okay, that's great. Okay, and I need you to now please cover each of your eyes. Yeah, this thing is pretty great because sometimes when you hold your own hand up to your eye, you can push down and it gets a little blurry. So this just covers it without pushing down so that you have perfect blurry free, well, as blurry unblurry as possible, sight when you go onto the next eye. Alright. Yep, so we're going to start with the left. Okay, please, and the 6th line. Yes? Sorry, I'll bring that a little closer. Okay, that one you can't. Alright, no, that's totally fine. And we're going to do this on the other side. Okay, can you do it backwards, please? Okay, fabulous. So, there are just a few, there's these gauges if you want to see. I know it's always interesting when I go to the doctor or the optometrist. I like to ask a lot of questions. So this one is just going to gauge for me the size of your pupil. And to do that, I'm going to have to shine the light back in. Yep. Okay. Yeah, it's in terms of millimeters. I actually don't know what millimeters is in inches. Fortunately, all of the measurements that we have here are in metric, so that works for me. Alright, okay, so I'm sorry, you'll have to close your eyes. Close them for me, please. Okay, and when I count to 3, I need you to open them up, and I'm going to shine the light in and gauge what width your pupil is. Okay. Sorry. Before I do that, I'm going to have to use this little measuring tool. Great stuff, great stuff. Okay. So close your eyes for me. Okay, and on the count of 3. 1, 2, 3. That's great. You just open and look at me. Alright. Okay. Give your eyes a little bit of a rest. Close them again so that your pupils can dilate together. Just keep them closed. That's perfect. Alright. And now we're going to do the right eye. Okay. And so keep them closed, please. Alright. You're doing so well. Thank you. Thank you. You're doing super, super well. Okay. I'm going to count to 3. And please open your eyes. Look into the light. And I will do a measurement here. Okay. 1, 2, 3. Okay, great. Yeah, you can shut your eyes just to recalibrate your eyes. And so, do you wear glasses? Yeah, no. Okay, that's perfect. I actually should have asked you right at the beginning. Okay. I want to do some measurements for your actual pupils as well. So this is my little measure, and it'll help me see where your pupil sits, and it'll also help me determine what size glasses you need. Alright, okay. So I'm going to need you to just look at my nose, please. Alright, okay. And look through each of these. I'm going to lift it up, and I need you to look through these. And then I'm going to lower it, and I need you to look over these, please. Okay, so we're doing through. Okay. Okay. Yeah, you can think, yeah, don't worry. Alright. Okay, look at my nose. Okay, and look over my shoulder. I'm going to bring the light back in. Great stuff. Alright, and I need you to look at this shoulder, please. Fantastic. And we're going to do the same thing. I need you to just look at the top now. And this is going to help me gauge all your glasses. Fabulous. Okay. So just look at my nose, please. Okay. And then bringing in that light one more time. Alright, and the other side. Just my nose. Keep looking at my nose. Thank you. Great stuff. Okay. And I have one last test with the measurements, that is. This one is similar to the other, but it will just give me an additional measurement that I need. Okay, so I'm going to hold it up to your eyes. Okay, I need you to look here and then here, please. Alright. Yep, look at my forehead, my nose, and my chin. That's great. Fabulous. Great stuff. And I'm going to do one last, so this is the last test for this session. And it is, I need you to read this entire thing as far as you can go, obviously. And I need to do with each of your eyes. So what we'll do is it'll be better if I call out the line for you. And you read out to me, and you tell me. We'll get to the last one, and I'll see how much of that one you can read. Alright, so cover the left eye. Alright, okay, so the second line, please. Okay, the fourth. Okay, the second from the bottom. Yeah, no, it's fine. Okay, and the last one. That one's blurry. Alright, that's not a problem. And we're gonna go onto the other side. Okay, and we're gonna read again. So the third line, the line below that. Okay, the second to last line, please. And the very last line. No. Okay. Yeah, that one, I mean, even for me, that one's a little difficult. That one's a little difficult to say. No, that has been extremely helpful for me. I need to do one last test. I'm sorry, I apologize. It's just with the light one more time. Yeah, no, and then after this, we're done. and I will be able to tell you what I think. Perfect. So you need to please just look at my nose again. This time with both of your eyes. Okay, and the light is coming in. Okay, and it's going to come in from the top of my nose. Okay. That's great. Alright, and from the bottom. That's great. Just here. Okay, and I need you to follow the light with your eyes, please. That's great, and I'm gonna go up and down now. Yeah, just with your eyes. And then one last one into each eye. Perfect, and the last. That is great. You have done so well for me. I can start to pinpoint what I think could be the issue here. Yeah, we're going to need to get you some new glasses. Yeah, this prescription isn't right for you, and that could definitely be what is causing those headaches. I think the actual frame themselves, I think that might be too tight. So that could be what is causing that tension headache. So we're just going to get something a little bigger. Okay, and do you work on the computer at all? Most of the day? No, that really is, that's most people, honestly. So one thing I'm going to ask you to do, and I need you to just kind of track the progress of this, but every 3 hours, yeah, give it 3 to 4 hours, when you're on your computer, just take a seat or lean back, and I need you to look in the distance and then back at your screen, in the distance and back at the screen, and you can do that 5 times. Okay, yeah, we can practice. Yeah, so look, use my finger as the screen. All right, and in the distance. Perfect, and back here. And perfect, that's great. And after that, you can just close your eyes and use your fingers to tap. Yeah, that'll just help relax the muscles, and not just on your eyelids, around your head. Yeah. That's great. Yeah, so come back in another week, please. I will call you and we can chat from there, but I will need you to come and try those glasses on so that we can see if they're the right prescription for you. Yeah, it's been fantastic working with you. Thank you so much. Yeah, I look forward to seeing you. Thank you. Bye.